HSJ has been analysing NHS England's data showing progress on the Quality, Innovation, Productivity and Prevention programme, known as the QIPP programme. I'm David Williams, I'm one of HSJ's reporters. This video will illustrate how NHS commissioners, both clinical commissioning groups and NHS England, have been performing on QIPP during the current financial year. The emphasis will be firmly on financial performance. This is because although QIPP is supposed to be about making the NHS more cost efficient by making innovations which also improve the quality of services, NHS England only monitors the programme's financial performance. This chart shows, region by region, the shortfall that was predicted by CCGs on QIPP at the end of Q1 of 2013-14. And here you can see how performance worsened in 3 out of the 4 English regions. Next, we can see how in Q1 CCGs around England were expecting to fall short on their QIPP targets by the end of the year. And in Q2, their forecasts became more pessimistic. Halfway through 2013-14, CCGs had a £113.1 million shortfall on QIPP in the year to date, but by the end of the year that was forecast to grow to £176.9 million. There is a similar pattern for NHS England's QIPP performance. In Q1, NHS England's efficiency programme was over £10 million, or 8.5% behind plan. By the end of Q2, that had grown to a shortfall of 13%. Just like CCGs, NHS England's forecasts for the full year are getting worse too. The expected shortfall rose from just under 13% in Q1 to over 18% in Q2. Nationally, that's combining CCGs and NHS England together, the year-to-date QIPP target was £454 million. The year-end target was about £1.9 billion. This chart shows the national QIPP shortfall in Q1 as a proportion of the year-to-date total and the full-year forecast. Here, you can see what happened by Q2. The year-to-date shortfall nearly trebled in Q2, and the forecast gap doubled. Across the country, transactional savings, those based on changes to contracts between commissioners and providers, are expected to account for more than half of the total planned efficiencies. And here we can see those transactional savings are overwhelmingly expected to be successful. The bulk of the shortfall, therefore, is expected to happen on the transformational side, those planned savings that relate to the redesign of services, which are key to the entire QIPP approach. But, as NHS England's data only measures financial performance, we're left with this question: what effect will the growing QIPP gap have on the quality of NHS services?